Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. We have an exciting show lined up. It's jam-packed. We'll get right to it. President Trump and Secretary RFK Jr. just announced bold new actions to confront the nation's autism spectrum disorder epidemic, which has surged nearly 400% since 2000, and it now affects 1 in 31 American children. Here to discuss what this means is Tony Lyons, Director of MAHA Action, a national movement dedicated to reversing the chronic disease epidemic. Welcome to the program, Tony.
Yeah, thanks, Kimberly. Great to be on.
Certainly. So can you tell us about this announcement by President Trump and RFK Jr.?
I think it was really fascinating that, Trump came out so strongly. And, President Trump doing that, the president of the United States coming out and saying that something is causing autism, that it's not genetic, that there are factors that are involved, that it could be the hepatitis B on the day of birth. It could be the combination of vaccines, the multivalent vaccines, that it could be Tylenol. So just that as an opener really kind of makes him the MAHA president, the autism president, somebody willing to address it. You can't have an epidemic like this in one generation going from 1 in 10,000 or 1 in 20,000 to 1 in 31. It's just not possible.
It's interesting because, I'm about to be 46. I remember growing up, I didn't know anyone who had autism. And now, personal revelation here, my brother's child has autism. So there's definitely something that has been going on, in the past 10, 15, 20 years. What do you think that is?
Well, in so many ways, what we've had is a kind of corporate fake science that purports to be real science, and yet in some kind of a 1984 way has told everybody who disagrees that they're crazy, they're conspiracy theorists, they're anti-science. And if you look at something like vaccines, you're faced with this statement that you hear day after day after day, which is that vaccines are safe and effective, that they've been really well tested, that there's nothing to be afraid of, and that there's really nothing to see here. But in this one book that we have just published called Forbidden Facts by Gavin DeBecker, something that you learn is where that phrase came from. So where did we learn? I mean, what is the science behind safe and effective? And there's a whole section on it. And the answer is that there really was no big research project done, that the Institute of Medicine was given this big problem. And it was the same organization that was given the problem of Agent Orange. And they were given the problem of Gulf War syndrome. And they were given the problem of the burn pits of Iraq and Afghanistan. And they were given the problem of Johnson & Johnson's baby powder. And they're a fully funded non-governmental organization, meaning they're fully funded by the U.S. government. So these same people found that everything that they investigated was safe and was effective and was of, no danger to anybody.
As someone who has had a child and was told, if you don't feel well, take Tylenol, and I know I personally did, what are your beliefs that there is that association between acetaminophen and autism?
So I think that, there's a lot of research that's been done there, and the most interesting research looks like it was from inside the company that manufactured it, and that in 2018, they put out a statement of some research that showed some kind of connection or some kind of signal that concerned them. The point is that you have all of these kinds of companies out there, these big pharma companies, these big food companies, big ag companies, and they just haven't had the best interests of the American public at heart.
Correct.
And so you just see that these people are just trying to make as much money as they can make over decades and decades. And what we have now is an administration that's not doing it for money, not doing it for more power, not doing it to become more famous. they actually want to get to the bottom of these issues. And so that, I think, is what's historic here.
We're going to take a quick break. We'll be right back with Tony Lyons after this. You are watching American Medicine Today. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect 98.75% patient satisfaction. 80,000 procedures have been performed exclusively at our location. Nearly half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. Welcome back to American Medicine Today. We're returning to our discussion with Tony Lyons.
There's something called cerebral folate deficiency. What is that?
Yeah, so that is something in the brain that is not functioning. There's a process that is not getting the folate to where it needs to go. But the bigger question really is that everybody presents to a doctor or in the world with some deficiencies, with some genetic predispositions. We all know that. People can drink for their whole lives, never have a liver problem. People can smoke and never get lung cancer. So how do we ever figure out whether autism, is triggered by a folate deficiency, whether it's triggered by a particular gene that then, if you get a vaccine, if you take Tylenol, if you have been primed by getting a vaccine on the day of birth, like the hepatitis B that you didn't need, what factors each of these things play? Because we have all the technology that we want. I mean, we have the greatest scientists. We have all these companies that are really just primed to do innovative research, but they're all held back by this corrupt system. This system that's kind of, that where our government has colluded with these big companies to just help them make as much money as they possibly can.
So what is the drug leucovorin, and what does it do exactly for those with autism?
Yeah, so, I mean, leucovorin, seems like it has a good impact on some percentage of people who have autism, that it can, increase speech, that it can take away some of the symptoms. And, once again, if you really believe something's genetic, then that sort of just gives you the green light to just sort of not think about it and to not try to get into the details of what might be able to prevent it, what might be able to treat it, how you might be able to actually cure it. And so I think that for a long time, people have known that, people who manufacture vaccines and government officials have known that there's a connection with vaccines. And so once you get past that, then you can try to figure out what that connection is and what changes you can make to the program to actually make it much less likely. And it's really only then that you think about what the mechanisms are, and then you can think about treatments and cures.
Unfortunately, we're out of time, but hopefully there is accountability down the road. Thank you so much, Tony Lyons, Director of MAHA Action, a national movement dedicated to reversing the chronic disease epidemic. Thank you for being on the program.
Thanks, Tony.
Thanks so much.
Take great care. Well, that's all the time we have for this segment. Make sure you stay tuned. We'll have more after the break. You are watching American Medicine Today. Soren Rasmussen spent his career serving the state of Illinois. After his well-earned retirement, he and his wife Mary relocated to Florida.
I was in Department of Corrections in Illinois for 25 years. Then we retired and we moved down here. It's really a nice place. We're in Lakeland, Florida.
Minor lower back pains developed over the course of Soren's life, and he was able to find relief with non-surgical treatments.
When I was in my later 20s, all of a sudden something locked up in my back, and I was able to go to a chiropractor. He was able to work it out. However, a few years later, it started reoccurring over and over again, and he kept getting it fixed, but then I got to a point where he couldn't fix it, so I went to a pain doctor. He burned off some nerves, and it helped for, I'm going to say a good 7-8 years. I didn't have too much problems, and then about a year and a half ago, I started feeling something slip in my back, and the pain has been pretty bad since then. Last August, we were in a very bad motorcycle accident that put me in a coma for 5 weeks. When I came around, I had to relearn how to do everything all over again. And here, I'm going to say about March is when I really started, other things were clearing up. I was realizing my back is pretty well messed up. The pain, it was going down my right leg, down the outside, all the way from the back all the way down to the right ankle. It actually felt like somebody was hitting me in the ankle when I'd take a step. It felt like somebody was hitting me in the ankle with a hammer. Basically, I couldn't really walk. I had a cane and I was hobbling everywhere I went. And I went to my regular doctor and he goes, let's go through therapy again. I says, I don't think therapy's gonna do any good. And we skipped that. So we went down to the pain doctor down here. Didn't help nothing. All of a sudden, one day, I'm walking and all of a sudden I couldn't walk. I went down on the floor and I was just screaming in pain. And it took a long time before I could even get in and get up. Well, I thought I was all right. The next day I went out to power wash the house, and the next thing you know, I'm rolling around in the yard. I couldn't get up. I couldn't do nothing. About a half hour later, I finally got up and got in the house, and I told my wife that you gotta find something. Something's really wrong here.
Mary found the Bonati Spine Institute while searching online.
She called them up, and the very next day I was down at the Bonati Institute. I couldn't believe how nice the people were there. They were just unbelievably, from the minute I walked in the door, they got me in like 5 minutes after I got there.
Using conscious IV sedation, the Bonati Spine Procedures allows surgical guests to be interactive with the surgeons during their procedure, painlessly guiding them to the cause of the symptom and verifying the source of the pain is removed.
The funny thing is, the first one they did, I don't really remember that one at all while I was in the procedure. The second one, I kind of remember almost all of it. They told me they're going to do the 2 and the 3 on the right side. You can't really feel much. There's no pain at all. There really isn't any pain. It's just, and they tell you that they want you to tell them while you're in surgery, what are you feeling and where you're feeling it. But I remember telling him, while he was in there, the left leg, the right leg.
Once surgery is complete, guests are relocated to the recovery area for post-operative rest and a final check-in with the surgeon. It's at this time most Bonati Spine Institute patients can be absolutely sure their pain was alleviated.
I felt relief from the nerve pain almost instantly, and the pain is still gone, and you're up walking around and the pain is still gone. It's just amazing. Right after the surgery, I walked out of the Bonati Institute without a cane. It's just amazing how good this stuff is. If you're beyond a pain doctor, you need to go there. Bonati Institute, because they're going to take you in and take care of you like you're gold.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. Welcome back to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. So the Trump administration is considering setting up a government-run website that would help people buy medications directly from pharmaceutical companies at a much cheaper price. Joining us to discuss is Dr. Bill Hennessey, price transparency and health cost savings expert. Welcome to the show again, Dr. Hennessey.
Thank you for having me.
Certainly. So President Trump has repeatedly pushed drug makers to really lower their prices. So what happened with this website? Are they trying to label it TrumpRX?
This is so new. The answer is yes.
Okay.
I'm looking at this as a PR win for both President Trump and Pfizer. So let's face it, Kimberly, the drugs that we're going to get at a cheaper price are going to be ones that are much more elective and routine from your family doctor's office. It's going to be Lipitor for your cholesterol, Zoloft for your depression, Advil for your headache or muscle ache, Viagra for you know what. These are common drugs for Pfizer. Many of them are in the $5 to $15 a month range. So if they're telling, we're going to save you on drugs, we're going to slash them 50%, okay, we're going to lower them $5 or $8. That's not the issue. The real issue is when you have expensive cancer drugs, Ibrance for breast cancer, Zandy for prostate cancer. We're talking drugs that could be $10,000 to $20,000 a month. Ones at that price, the insurance companies often deny. Ones at that price, you're going to be paying your full $5,000 or $10,000 deductible that you don't have.
Wow.
So a lot of that care must be delivered in the hospital, and you're stuck with hospital pricing, with the Pfizer pricing embedded. So I don't see it helping the more expensive drugs.
I know we've had you on talking about drug prices before, but can you kind of explain why we pay so much more here in America? Does it have to do with like the research and development and all of that, and the other countries don't have to pay for that stuff?
Please don't be so altruistic. Follow the money. That's it. Follow the money. So
Okay.
What's happening here is there's 3 companies that control about 80% of medicines in their pricing. Their names are United, which is really TrumpRX and their drug saving company. Wink, wink, drug saving, not really. Cigna and Express Scripts, wink, wink. And Aetna, aka Caremark. These pharmacy benefit management companies, let's simplify it. It's an additional middleman. And now, because of the middlemen and the money-making opportunity, we're forced to pay more.
This is crazy. How can this possibly be legal? And how many of these pharmaceutical companies actually signed up?
It's, well, as far as I know, only Pfizer did to date. But the legality, it's not legal. That's why the Department of Justice and Federal Trade Commission have each sued the big 3 pharmacy benefit management companies I just named, by the health insurance company giants, for illegal drug price fixing of both generic drugs and insulin. Some of the drug manufacturers have had payouts this year. The PBMs, as they're called, should start having payouts next year. One way to curtail bad behavior is to punish it with a lot of money. And that is what is going to happen. So you look at what President Trump did. There's TrumpRX, that's one avenue. There is suing these illegal drug activities, that's another avenue. And then yet another one is we get favored nation status equivalent to other industrialized countries in the world. So, you know, if France or England is getting a drug for $10 a month, and we're paying $200 a month, we're going to get it for $10 a month. I do think that there's ways to do that now. The block in the past has been the government at the FDA, Food and Drug Administration. And what they did was say, oh, we don't know if the quality of those drugs those people in France and England are taking are good enough for Americans. Well, it's the same ingredient. Now you have a kind and caring MD and Marty McCary, MD, leading the Food and Drug Administration, working with President Trump. So I do think at some point this year, and I don't know by how much, but it's a good thing that there is a Trump favored nation executive order. And it's a good thing when we have an MD at the head of the FDA. They'll get something done.
Kind of in the same realm, but a little separated. I wish they would crack down on these insurance companies who are trying to make medical decisions and practice medicine without a license.
Yes. So here's my...
And then they get their billing codes. So it's so
Here's
disgusting.
my hypocrisy there.
Yes.
So if I, Dr. Hennessey, am good enough to be in United Healthcare's network, and I prescribe care for Kimberly, they shouldn't be able to deny it because I'm so good. I'm in the network. If I said it so, then Kimberly gets it.
Right.
There's only one key determinant to whether care is approved or denied: price tag. But if I prescribed you $10 or $200 care, no problem. If I prescribe you something for $5,000 to $100,000, I'm jumping through hoops, you're jumping through hoops, and there's still a good chance it's not going to be paid for because across all 4 carriers, 20% of claims are denied USA. It's disgusting.
It's sick. They want their premiums. They skyrocket their prices. And when it comes to care, they put up every stumbling block along the way.
They're doing it for now, but I predict they're going to become the blockbuster of medicine. There's going to be a Netflix coming along. So what's happening, I'm seeing in the marketplace, you're getting more other non-Blue Shield, United, Cigna, Aetna offerings. And we're separating care from insurance. 99 out of 100 of us only need a doctor visit, a little blood work, a mammogram or chest x-ray. We're not consuming real, but if you separate and just pay cash for that care, it wouldn't cost you much. And insurance is only for what? A catastrophe.
It's a different mindset. I mean, if you think about previous administrations, they wanted to do all of these things to, quote, help the people. And all they did were ruin insurance. Insurance used to cover things, but they made it to become what, like universal health care. They wanted Medicaid for all, Medicare for all. And that isn't what we do here. We're not a socialized country.
Well, we're headed that way.
Well, hopefully not with this whole like MAGA and MAHA movement. Hopefully we're getting to the heart of everything and making insurance accountable.
There is going to be more better price solutions, I promise you, as we go along. I will tell you the 5 reasons we pay the most for healthcare: Blue Shield, United, Cigna, Aetna, and hospitals. Those are the enemy of affordable access to care. So if you can use a physician who's in private practice, it's 1/3 the price of one employed by a hospital. If you get blood work at Quest Diagnostics or LabCorp, it's going to cost you 1/4 of what it does at a hospital. The electronic medical record, the EMR, is used by hospital-employed physicians, and the administrators tell them that they have to refer only to hospital providers. So even if there's other better priced providers in your neighborhood, if they refer you to someplace other than the money-grabbing hospital, those doctors get a talking to and get fired.
Yes. Yeah.
So they don't care that Kimberly or Ethan goes bankrupt. They care about their corporate greed. It's profit over patient. So you need to stick up for yourself when they say, you got to go down the hallway for blood work. Well, I say, trust your doctor with your life, not your wallet. Get out of there and go to Quest for your blood work. Go to an independent imaging center for your x-ray.
100%. You need to be your own best advocate. Thank you so much for being on the program, Dr. Bill Hennessey, price transparency and health cost savings expert. Thank you for joining us on the show. Thank you for watching American Medicine Today. That's all the time we have for this episode. If you would like to see previous episodes of our program, you can download American Medicine Today to your favorite streaming device.
If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.